Hi, I'm Mark Senak, Senior Vice President and Partner at Fleshman Hillard and author of the weblog Eye on FDA. I wanted to ask Dr. Kessler a question, and that was about how the public mindset has changed since he was FDA Commissioner. It seemed like back then in the 1990s, with an AIDS epidemic raging and no new treatments and very long approval times for new drugs, what people wanted more than anything else was faster access. And we got that through fast track and accelerated approval of drugs and a whole new system for how we approve and consider new drug applications, and the time was shortened. It seemed like, though, in the 2000s, things changed after a few bad experiences. And what people wanted more than anything else was to be made safe from risk. They wanted risk mitigation. They wanted risk aversion. So I asked him, what happened between the 1990s and 2000 that caused things to change so much?
I think it's a little more, as you know well, I think it's a little more complex than that. Right? I mean, there's no doubt that when we started off, I mean, in the early 1990s, you know, the line from the AIDS activists were, you know, we want access, we'll figure out how the drug works. I mean, and you can argue, I mean, that was important. There was only one drug on the market at that time for HIV. It was mediocre. It didn't work very well. Those same activists sat around the table 3-4 years later and said, please don't give me another drug that I don't know whether it works, at what dose it works, and hold the companies accountable. So I think the fact is we've always wanted it a number of different ways. We want drugs that are safe and effective, and we want access too. That's what makes FDA's job so hard. I don't think today, if you have a drug for an important disease, a drug that could potentially save lives, I think the agency, I mean, the agency is made up of physicians and scientists and engineers and statisticians. I mean, I don't think that's changed. If you have a drug that can make a demonstrable difference in people's lives, you're going to be able to get it through. I think that for the average drug that's not going to do that, right, for which there are many drugs in a class, there's no doubt that the standards have gone up. There's another thing that's happened, and that's the agency has said we're going to be more transparent about what we do, which means that the agency is going to tell the American public what is on its mind sooner, whether in fact, in the end, those concerns really are true or not. So if it has a concern about certain risks, and the data is not all there yet, the FDA is committed, and you see this happening, where the agency puts that out and informs the American public, but doesn't know whether in fact that risk is going to turn out to be true or not, but disclose that earlier on. And then more data will come in, and we'll see whether that warning holds or it doesn't hold. Is that a good thing? Probably. But as you can see, going out before you have all the data, you're going to sometimes make mistakes and alarm certain people. But you trade, you know, that risk for greater transparency. Fact is, you know, FDA doesn't have a crystal ball. It's never going to know things before the science is in. It's never going to know everything a manufacturer knows about a drug. Sometimes it can collect data and hold it up in a way the manufacturer has not looked at the data. But there are some fundamental transformations that are going on within the agency. The agency has learned. It learned from heparin, and it certainly learned from Vioxx.